call up all of our training psychologists, Dr. Jeremy Bidwell, Dr. Kyle Bowenspiel, Dr. Claudia Mosher, Dr. Brandon Bowen, Dr. Gretchen Bowles, Dr. Mary Talon, Dr. Ken Fogel, Dr. Brian Humphrey, Dr. Derek Phillips, and others who are here who I haven't mentioned, please come up. Dr. Dan Warnock, Dr. Nancy Dealey-Haney, and Dr. Liz Bushner. So these are our first prescribing psychologists in the state of Illinois. And they're going to talk just for a minute, just to tell a little bit about their training and their passion for this to you, to be able to convey their enthusiasm to you.
Thank you, Dr. Beth, and a great mentor and a person that truly encourages every one of us almost every day. But I would like to just mention that I am doing my rotations within the Amity Health system, and I'm very grateful for that. I am actually a nurse as well as a psychologist, and so when I learned that Illinois had passed a statute, it was an absolute thing. I knew immediately I was going to apply because I felt that it was an extension and a maturation of our profession as our other health professionals. But what really moved me in terms of passion is that I am a psychologist with the 16th Street Clinic, which is a federally qualified health center in Milwaukee, and we definitely serve the underserved. And I knew then and there I wanted to come back, and I hope Wisconsin finally gets it together because I'm from Wisconsin. But I certainly am going to practice with the grace of God, and I hope telehealth will enable it.
Thank you so much. I just wanted to make one mention. I forgot to mention this before. So also on the morning of July 19th of 2019, our second piece of prescriptive authority legislation was passed, giving prescribing psychologists the authority to use telehealth in their prescribing in the state of Illinois. Before that, they did not have that, only psychologists.
Good afternoon, everybody. I will tell you that it feels so good to finally start the practicum. It has been a long road, and all of us up here, everyone in the crowd that has been psychologists, I know you know the things. You know the people that need it. And finally, we are on the road to being able to see how we can use all our nerd knowledge for grad school twice now to be able to do it. And that feels good. So the 20 months ahead of me feels like a long time, but the 7 months behind already has gone quickly. And as others have mentioned, we know the people that need it the most. And we're finally able to see that in real life, day to day. Thematically, it sounds great. But to be able to do it hour by hour feels even better. So, thank you, and sign up for school.
Good afternoon, everyone. Speaking, I feel like I'm following so many people that have come before me in terms of prescribing psychologists, as well as all of the folks that have spoken today about the access issue. I am an Illinois native from downstate Illinois. I currently work as a clinical neuropsychologist at a public not-for-profit hospital that serves 11 very rural and very underserved counties. Speaking of that, I will. I'm finishing up my master's in psychopharmacology. 17 days, not that I'm counting. I will start my clinical rotations in January, also at the hospital where I currently work. With Beth's help, we created it is a site for RXP training. And so I'll begin my 18-month-ish rotations at that hospital. And I also want to echo my thanks to Beth, thanks to the Illinois Psychological Association, the American Psychological Association for being so extremely supportive of RXP, so that I can fulfill my dream and also try to help fill that gap for services that I see every single day where I live, where I was born and raised. So thank you very much.
Hi, I'm Brandy Bowen. I am also going to echo what most of the people said about rural America. I grew up on a farm in southwest area of Illinois, and as everybody I think is starting to see, the access to care is few and far between, especially in rural and poor rural areas, with 60% of psychiatrists being 55 or older, and there being a 60% unmet need in rural America, and there is extremely high suicide rate. Farmers are 4 times more likely to commit suicide than the general population. That my hope is to be able to help also fill in that gap. And I was very blessed when Dr. Reimer worked with the McHenry County Mental Health Board to help fulfill that dream and also help financially facilitate that, because let's face it, student loans are not very nice. So I've been very, very fortunate. I will be sending in my application to the state next month, and hopefully we'll kind of see where it goes from there.
Good afternoon, I'm Kyle Wallensteel, and it's certainly an honor to be sitting in front of this crowd. When Beth asked us to speak briefly, 2 words came to mind as to why I decided to pursue this training. Certainly the access issue that we've all been speaking about, but 2 other things I think are really important to mention. One is quality, and the second being integration. So, as a neuropsychologist, I would find it very attractive to be able to comprehensively evaluate a patient at the front end, be able to assist with some of the differential diagnosis as to other things that may be contributing to the patient's psychological symptomatology, and then follow them through treatment-wise, whether it be psychotropics or other modalities, all the way to symptom control. I think that's a phenomenal model, and it really capitalizes on our strong history, our roots as psychologists in terms of quality assessment, psychometrics, and being able to quantify the psyche, as it were. So that was one thing that really drew me to this. I also envisioned a future where we're prescribing not only based on clinical presentation, but also based on pharmacogenomics and brain circuitry data and so on, so that this profession of our psychology, again with the strong roots in assessment, can start to utilize some of that biomarker type paradigms for more efficient prescription efficacy, particularly at the front end, so that we can be effective quickly, so that we don't lose patients to dropout or demoralization. And what I've seen so far in my training is the importance of integration. If one wants to be integrated into a system, into a culture, and medicine is a culture, we have to be able to speak the language. We have to be able to really connect with our physician colleagues in order to be able to talk the talk. And I've already seen how that's been very beneficial in terms of establishing high quality integration. And finally, I think one of the throw-ins, the benefits of all this has been to have a new cohort. It's been a little while since I was in graduate school. This feels like a sort of resurrection of having fellow comrades in this process. So that's been a really, really cool thing. 2 other quick things. I too want to thank Beth for all the amazing things that she's able to accomplish, but also specifically her wondrous ability to make you feel honored for whatever your contribution has been. She has a way about that. No matter how small, how big it is, you feel honored for what you've contributed. And last but not least, I just want to say thanks to Clay, Rocco, and Rick for a wonderful program you're putting together at Anamita. It's top notch, and I've been there 2 months, and the psychiatry rotation, and it's awesome. So you guys have done a great job.
Thank you, Kyle, and I'd like to echo everything that my cohort has been saying. First of all, thought about it for a long time, but it was about 5 years ago that I actually took the leap. And it was after RXP had passed in Illinois and had a very long conversation with Beth, and she encouraged me and inspired me, and within 2 weeks I started the master's training program, and I've never looked back. So it's been 5 years now, completed the master's, completed the PEP. I'm now also currently at AMITA, and I've got 3 rotations left. And AMITA, again, incredible training program. We truly are pioneers. This is kind of like the Wild West for us. We're creating as we go, and we're meeting incredible people, and the friendships that I think that I've made along the way have also been a huge bonus. The thing that I've noticed, I think back to when I started psychiatry back at London Oaks last summer. And so we had a group of several different types of trainees. I was the anomaly. I was the only psychologist going for prescription authority. But APNs, we had PAs, medical students. And the psychiatrist went around the room during our lecture case conferences and said, why doesn't everyone kind of talk about, their training background and so forth? And then we came to me. And I was very impressed that he had a really good grasp of what we're doing and was very complimentary. He said, you as medical trainees, in a sense, are going to learn a lot from the prescribing psychologists because we have a wealth of knowledge. We have a unique perspective. Me coming from a very psychodynamic background, understanding transference, countertransference, defense mechanisms, object relations, self-psychology, things that a lot of them kind of scratch their head saying, okay, what's that? And how does that pertain to what we're doing? I feel like I brought that into all of the different medical rotations where I've been working in very subtle ways. I would say most of the rotations I've left, they've been sad to see me go because I've helped them navigate very difficult patients. Help them, question beyond the symptoms that they're presenting and take it down to a deeper level, even in a very short period of time. So my final words are, I think as psychologists, we've come out of the office and we've gone into treatment with the physicians, with the treatment team, and we are truly a part of the team now. We are no longer sitting in that office where they're scratching their heads and wondering what we're doing.
I'm Jeremy Bidwell. I wanted to take my time just to tell you a little bit about what it's like going through the rotations, especially for the students out there. I did my first 6 rotations at Loyola University Medical Center and am completing my last 3 at AMITA, which has been a phenomenal experience. I probably partnered up with around 60 physicians in the process. I did my first rotation at Loyola in neurology, and to give you a sense, the first day they were playing a game called Find the Lesion when I came into the resident room. They had an MRI up on the board with a tiny dot, and the attending said, "Where is this?" And the resident said, "Basal ganglia." And he said, "Great, that's the continent, I at least need the country." I died a little on the inside, but the entire rotation was like that. I felt like I got a year's worth of education in the 8 weeks I was in that rotation. And when people would say, "What's your favorite rotation?" all of them, like each one I felt like was my favorite rotation all the way through. And everyone has been so supportive and welcoming in all of the rotations. It's been a really encouraging experience. I know a lot of people felt like the rotations were unnecessary, but I think amongst us, the consensus has been that's not true. It's added so much to our education, and it's been such a career-changing experience. When I was at AMITA, the Center for Mental Health, thanks for having me, Rick, it's just this really warm community of providers. It's an incredible place to train. And my last week there, the psychiatrist that I was with, we were talking about my next rotation, which was obstetrics. And he had said, "You're ready?" And I said, "For obstetrics?" And he said, "No, to prescribe." And to hear a psychiatrist say that after kind of everything that went on with the bill was just phenomenal. I felt like it really kind of solidified that. And for me personally, Dr. Walker funneled me into psychopharmacology at Nova back in 2006. That's when I did my MS degree. I did it as a PhD trainee. I hadn't graduated yet, which at the time was super controversial. I didn't know if I was going to be able to use my degree, and just serendipitously I ended up in Illinois, where that's not only allowed, but it's really encouraged by the law here. So thank all of you for giving us a path to finish this.
Hi, I'm Claudia Mosier, and I've done all but one of my rotations so far. And I want to thank my family of choice, my wife, because I disappeared to have to do all this training, and it's the support that I've gotten has been phenomenal. Of course, I thank all the people that got us to this position, and without Beth, none of us would be standing up here. My job is to do a quick vignette, a quick snapshot of what the training has been like. So when I started my surgery rotation, none of us in my cohort group had done a surgery rotation yet. So we kind of thought that no way would they let us in the surgery room. I was wrong. In the first 10 minutes, the surgeon said, "Get the right clothes on and meet me in operating room 4. I didn't say a word. I turned around and I started looking for the right clothes, and I got sorted out thanks to the kindness of an operating room nurse, and then I faced the surgery room. I didn't know how I would deal with surgery. So I walk in, and he's debriding a gangrenous infected wound, of course I'm nervous now, decubitus ulcer. My only thoughts were, don't throw up, don't faint, don't touch anything sterile, and don't fall in the surgical field. That was my mantra for my first hours of surgery. After I finished the surgery rotation, I talked my way into my elective rotation, which was in gender affirmation. And I was glad I had a general surgery rotation first, because the gender surgeries are difficult to watch. And I had a better understanding of the skill that it took to do the gender surgeries. By being able to be embedded in a gender affirmation surgical team, I've been able to see most of the surgical procedures that happen for people that are looking for gender affirmation. I now know the hormonal, the psychotropic, the medication changes that need to happen both before and after surgery. I understand the challenges for the patients who are preparing for surgery. I understand what the healing process is going to be like. I have a more nuanced understanding of informed consent, and I can better assess my patient's readiness for surgery. If I wasn't in the process of obtaining prescriptive authority, I would never have learned these things that have an immediate impact on the patients that I serve.
I'm Ken Vogel. Right now I'm teaching at the Chicago School of Professional Psychology. I'm a little bit different than everyone here. I'm kind of more of an academic at this point. So about 10 years ago, Beth tried to get me to do the training. And then 9 years ago, she tried to get me to do the training. It was 8 years ago. And the whole time it was like, it's not the right time, it's not the right time, it's not the right time. I will say one thing, that as much as the Beth does, she's extremely available. I would always call and say, I'll just leave her a message, but she'll always pick up the phone. So I don't know how you do everything and then also answer the phone. It's easier to get in touch with her than my kids. Okay. So I just finished the Master's in Science Clinical Psychology, MSCP, at Alliant University in May. And so I will be seeking what you guys are so wonderfully doing. Probably in January. I have interviewed a la practicum internship at Amita. Feels like being a grad student again. So I'm looking forward to getting back into clinical work, because I've been teaching for about 12 years now. Before that I was doing clinical work. Another one of my hats is consulting with DCFS, so seeing all the medical needs in terms of that. Claudia was doing that before she jumped ship. So I'm looking forward to basically touching down after being in an ivory tower for a while. One of the things I want to mention, which I think is important to consider, people have talked about access, everything that people have said is really important. One of the things that I want to have us keep in mind, is the fact, and this is what my focus is, on de-prescribing or unprescribing just as much. That yes, there's a big need for care and appropriate medications, but as we know, there's a lot of people out there who are on too many medications, inappropriate medications. And that is, to me, one of the main reasons I'm doing this. And it's not to get everybody off meds, it's to maintain a sense of balance. So wherever it is that I'm working, any area, any population, it's making sure that the person's on the right meds, not too many, not too few. Trying to come up with an analogy, I thought, it's basically keeping an eye on the baby while draining the bathwater, right? That's kind of how I'm looking at it. So to me, it's restoring balance, and it's getting back into the nitty-gritty of clinical work. Thank you all for slogging in the swamp and laying some planks for me to walk on while I was falling. Thank you.
Good afternoon, everyone. My name is Brian Humphrey. I'm a clinical psychologist here from Chicago, Illinois. I know we've talked a lot about access of care, and so one of the things that motivated me to get into the field of psychology was actually firsthand experiencing and coming from an area that was very poorly, had very poor resources, and being able to see firsthand the need that was there. And so as an agent of change, I've definitely been working throughout my career, whether it's been, was at Mondale Christian Health Center for a period of time on the west side, all the way through Illinois Department of Corrections. Presently I am at Cook County Health System, and one of the things that I continue to see is two big things: a lot of minorities, a lot of individuals, a lot of patients that we see who are underserved, either being overdiagnosed or misdiagnosed. And so with that, one of the things that was very interesting as I was going through the Chicago School of Professional Psychology, where I'm now officially completed and graduated with my clinical psychopharmacology degree, one of the things, thank you, one of the things that led me there, of course, was Beth. I want to say one of the things about Beth is that she is very much an individual who empowers. She really, really does a lot of encouraging, and so it is in her spirit of belief in me that I chose to continue to pursue this dream that I had to be able to fill the void that was in a lot of the communities that I had seen and that I've come from. And so, as kind of previously mentioned, one of the things that I've seen a lot of is the ability also to be able to unprescribe. So we see a lot of individuals, especially minorities, who are oftentimes misdiagnosed and overprescribed. And so not just to be able to prescribe, but having the balance to be able to establish what's the perfect rhythm, I think, for individuals. Another area of interest through the Chicago School that I learned that I didn't really necessarily realize that I had, but through the coursework, which was very rigorous but very rewarding, was that of research. And so a research area that I have is pharmacogenetics, specifically with African Americans, looking at biomarkers to be able to contribute to precision medicine. So being able to make sure that the medications that are being prescribed are not being overprescribed or misprescribed. And we know that with many African Americans, there is a great resistance to medication for obvious reasons that we are probably all aware of. And so being able to more immediately and accurately provide a repertoire of pharmacological agents, in addition, of course, to our psychological training, being foremost, of course, I think, as I have done so far, really opened up the door for lots of individuals to be receptive and open to different interventions, no matter how they may come. So I definitely want to give thanks again for Beth. I want to give thanks to everybody who has made it possible, not only for me to just to be able to go to school, but to also be able to have an awesome career and also re-enter school as a grad student, and also be on the way to be able to prescribe. Hopefully I'll be looking to do my rotations very soon, maybe around January or so, so it's really good to hear you guys' experience. Thank you. And looking to not only receive those awesome benefits, but to leave some contributions as well for those who will continue in this path.
I am super nervous. My name is Mary Talon. I'm from Northwestern's Family Medicine Residency Program, and we're housed at Erie Family Health Center. I never get nervous in front of physicians, but a house full of psychologists is just making me quake. So I want to say, first of all, I'm in Humboldt Park, which most of you know by now because it's national news. Chance, the alligator, is our home base mascot. So I want to just say a little bit that I am on the crock pot, slow simmer part of training. And this really comes from the bookends of my career, starting with Ron Fox, who some of you may know, who was my mentor back at Wright State University, who was the pioneer to champion us into prescribing psychologists. So I just want to honor his work and to say the other end of my bookend is Beth and her leadership and a sense of advocacy and really rounding out this whole career in my life of seeing how something can move forward. That's like 35 years worth of work right there. So it should come out from the crock pot with the right spices and tasting really well. But I am still in that slow simmer, and I am so grateful for Erie Family Health Center, which is devoted to a Latina community. They're working with refugee communities. They are champions for under-resourced individuals, families, and their community group. And I am so fortunate to work with this group of people who love team-based care. And our voice as psychologists and what we bring to the table in terms of research, thank you for saying the R word, and for our assessment tools is so valued. I can't tell you the number of times I round in the hospital and I get paid to ask questions like, does this patient have anybody important in their life? And their mind, they go blank, they're rattling off all of these lab values, blah, blah, blah. And to bring that sense of personhood and for them to help me get the biomedical perspective makes it so much richer in terms of our giving back to the people that we're here to serve.
Hi everyone, my name is Anna Maria Laguerre, and I am finishing the program at New Mexico State University. I am a Polish-speaking neuropsychologist here in Chicago, and talking about access. Just want to inform you that in Chicago, there's more Polish speakers than in Warsaw. And there's maybe 5 doctors of clinical psychology in Chicago speaking Polish. We have maybe 2 or 3 psychiatrists that are actually able to speak Polish and prescribe. So I think I'm going to possibly make that happen for more and more in terms of the access for Polish speakers. Thank you.
Okay, great. Thank you.